Welcome to another video. So in today's video we'll be talking about one of the sexually transmitted infections known as syphilis. So basically we'll be looking at syphilis. We'll also be looking at gonorrhea, but that will be in another video. So basically syphilis is a chronic systemic sexually transmitted infection and is caused by a particular bacterium known as Treponema pallidum. So basically syphilis progresses through 4 clinical stages. So we have the primary stage, the secondary stage, the latent, and the tertiary stage. So each stage has its own distinct signs and symptoms, and if this syphilis is left untreated, syphilis can cause severe systemic complications involving the brain, involving the heart, and many other organs. So basically syphilis can also be transmitted from an infected mother to her baby during pregnancy, leading to something known as congenital syphilis. So looking at the background, syphilis has existed for centuries and was historically a major cause of morbidity and mortality before the discovery of antibiotics. And basically following the introduction of penicillin, these syphilis rates, they've declined significantly, but there's a resurgence that has been that has been observed in recent decades. So this syphilis infection is now considered a global public health challenge, particularly in populations with limited access to health care and among men who have sex with other men. So as a re-emerging disease, syphilis presents with varied clinical manifestation, making diagnosis and treatment both crucial and complex. So the thing is that syphilis there's a kind of infection. It is like it has different signs, and like it has a variety of signs or symptoms. You can mirror different other infections, and usually it's very hard to detect for doctors to detect this particular infection, because it can mirror the same signs and symptoms as many other infections. That's why it is sometimes known as the imposter, because it can mirror different clinical manifestations. So it is very hard to diagnose, like on just using the patient's clinical presentations, or just observing the patient's clinical symptoms. So looking at these clinical symptoms, it's based on different stages. So for the primary syphilis, like I said, there are 4 clinical stages of syphilis. So there's primary, there's secondary, there's tertiary, there's latent. So for the first one, the primary syphilis, so in the primary syphilis we can have symptoms like there will be presence of a painless, firm, round sore called a chancre that appears at the site of the infection. So it appears in the genitals, the anus, or even the mouth. So it is usually present in these areas. Then there will be an enlarged or non-tender regional lymph nodes. Then the chancre, that is the sore, it typically resolves within 3 to 6 weeks, even without treatment. So looking at the second stage, secondary syphilis. So secondary syphilis, it occurs weeks to months after the primary lesion heals. So like I said, there's a primary chancre that develops, the primary sore that develops. So after this sore heals, then we move to the secondary syphilis, secondary stage. So it occurs weeks to months after this primary lesion heals, and symptoms can include a diffuse maculopapular rash, often involving the palms and the soles. There will be mucus patches. There will be something called condylomata lata, which is moist wart-like lesions in the genital areas. Then fever will be present, sore throat, a feeling of general malaise, which is a feeling of you just don't feel well, like you don't feel well. Then lymphadenopathy too, and it may also involve alopecia and weight loss. So hair loss can be involved, and loss of weight. Then looking at the next stage, that is latent syphilis. So in latent syphilis, we don't see any clinical symptoms, and the infection is detectable only through serologic tests. And this latent syphilis, it can persist for years. So for tertiary syphilis may occur years to decades after the initial infection, and the manifestations include rheumatous lesions, that is granulomatous growths in skin and organs, and also it can include cardiovascular complications like aneurysms, and it can involve something called neurosyphilis, whereby there will be cognitive dysfunction, sensory deficits, and some stroke-like symptoms too. So basically, if this syphilis has reached the tertiary stage, this is basically like the height of the disease. This is the most complicated stage of syphilis. So looking at the clinical presentation, so patients, they may present with a painless genital ulcer, then a diffuse body rash including the palms and the soles, and then neurological symptoms, like I said before, like visual disturbances, headaches, or motor deficits in the late stages of syphilis. Then systemic symptoms that occur in secondary stages, like fever, malaise, lymphadenopathy. Then in congenital syphilis that is transmitted from the mother to the baby, there will be nasal discharge, rash, bone deformities, and developmental delay. So looking at the etiology of syphilis, what causes syphilis? So syphilis is caused by a particular bacteria known as Treponema pallidum, and Treponema pallidum is a delicate spiral shaped bacteria. Is part of the group of bacteria known as spirochetes, and it is highly infectious. And how is this syphilis transmitted? Syphilis primarily occurs through direct contact with the infectious lesions during sexual activity, and other ways it can be transmitted. It can be transmitted through blood transfusion too. It can be like blood transfusion from a patient that already has the syphilis infection, and then it can also be transmitted from mother to fetus, like I said. That is congenital syphilis during pregnancy. So the organism penetrates through mucosal surfaces or abraded skin and disseminates through the body. So looking at the risk factors of this syphilis, number one, engaging in unprotected sexual activity. Then having multiple sexual partners, and men who have sex with other men is also a risk factor. Then history of having history of other sexually transmitted infections. Then individuals with limited access to sexual health education or health care are also at risk, and pregnant women not undergoing routine prenatal screening are also at risk, because undergoing this routine prenatal screening can show if they have this syphilis, this congenital syphilis. So if they are not undergoing their routine prenatal screen, they cannot even detect this condition earlier if they have it. So looking at the anatomy and the physiology, so this Treponema pallidum, it enters through mucosal surfaces or microabrasions in the skin, often in the genital areas, the anal areas, or even the mouth. So it travels through the lymphatic system and the bloodstream, disseminating to various organs. And in tertiary syphilis, it can reach the CNS and the cardiovascular system, which are basically the major targets when we have this stage of this infection. So the immune system attempts to control the infection but fails to eradicate it, leading to something known as chronic inflammatory damage over time. So looking at the pathophysiology, so Treponema pallidum invades host tissues and causes local inflammatory reactions. So the bacteria disseminates systemically, leading to immune-mediated tissue damage. So in secondary and tertiary stages of syphilis, chronic immune responses contribute to widespread tissue destruction, and the bacterium can cross the placenta, leading to congenital infection. And in neurosyphilis, which is the most complicated stage, inflammation of the meninges and the blood vessels results in neurological deficits. So for the diagnosis of syphilis, so diagnosis is based on laboratory testing, clinical features too, but it's quite tricky when we use only clinical features. So for the tests that can be done, so there's some non-treponemal tests that can be used for screening and monitoring of syphilis. For example, is venereal disease research laboratory test. So this is the most common test that is done to check if a patient has syphilis. And then some treponemal tests like confirmatory tests that can really confirm that this syphilis is present, like fluorescent treponemal antibody absorption test. Then dark field microscopy to detect live spirochetes and live spirochetes from the source, the chancres. So but this dark field microscopy is not always available, so it's not always used because of the scarcity. Then there's also lumbar puncture, which is performed in suspected neurosyphilis to assess the cerebrospinal fluid. So looking at other conditions that could mimic the same symptoms of syphilis, so we have genital herpes, which usually come with painful sores. Then HIV related ulcers too, and drug induced rash, Behçet's disease. So all these conditions could mirror the same symptoms as we see in syphilis. So looking at the management goals include eradicating the infection, preventing transmission, managing complications, and ensuring partner treatments, the person's partner. So for the pharmacologic therapy, for first line, we use benzathine penicillin G intramuscular injection. For early stages, we give single dose. Then for the late latent or tertiary stages, is given once weekly for 3 weeks. Then for neurosyphilis, aqueous crystalline penicillin G is given intravenously every 4 hours for 10 to 14 days. So alternatives for patients that have tend to have penicillin allergy, so we could give them doxycycline orally for 14 to 28 days, and then we can also give them ceftriaxone injections. And then pregnant women, they should undergo penicillin desensitization and receive penicillin, because penicillin is the safest for them compared to other alternatives. So so when giving all these antibiotics, is good to reinforce adherence to the full course of the antibiotics and advise again for sexual abstinence until the condition is resolved, and also the treatment of the person's partner, whoever they've recently had sexual contact with. Is better to advise that, okay, this person too seeks advice and also comes for their own treatment too, and also arrange follow-up serological testing at 6 and 12 months after the infection. So looking at the prognosis for syphilis is excellent with early detection and treatment, and early stages are fully curable without complications. When it gets to tertiary syphilis, it may result in irreversible damage, and then congenital syphilis can be prevented with routine maternal screening and treatment. So going for prenatal appointments is very effective. And then long-term prognosis usually depends on timeliness of the diagnosis and the initiation of the therapy. So some of the complications that can occur when treatment is not given when the patient has syphilis. So like I said before, it could get to the tertiary phase where we have neurosyphilis, which could bring all these other infections like meningitis, dementia, all these other conditions, vision or hearing loss. So when the CNS is affected, things just become more, I don't even know how to put it. Things just start getting, it's just downhill from there. But that's why it's best to get early diagnosis and early treatment, because usually when it gets to this tertiary phase, it means that the person has not really been paying attention. Like the person would have probably seen the primary infection first, seen the ulcers, seen the sores, seen everything, and just ignored it. That is when it will now lead to this tertiary syphilis. So cardiovascular complications too can occur, like aneurysms, and then there will be some gumatous conditions like gumatous syphilis, where you see tumor-like lesions damaging organs. Then congenital syphilis we could have complications like stillbirth, neonatal death, and development issues in the child. And then psychiatric complications too due to chronic infection. So it's just best to follow the accurate dosing regimen, make sure you take the proper treatment. And if you are seeing these particular signs and symptoms, it's better not to overlook it, so it won't get to this detrimental phase, this tertiary stage. So that is basically it. So yes, okay, thank you. So I'll see you in the next video. Bye.